One of the most important things that you can know about addiction is that stigma kills. Hello, this is Dr. Mario Sambartolome, your family medicine and addiction medicine doctor, here to explain a few more terms. So welcome to our series. Today we'll be talking about the stigma that plagues addiction. And so what do we mean by stigma? Well, what we mean is that there's this thing out there that controls how people view what we see as addiction. And it comes from a long history and many, many variables where people that have addictions actually are thought of in very negative light. And that has not done us well for helping people get health care. It actually makes a difference to whether somebody even seeks care. The best example of that might be a mom that's pregnant and uses substances. And she may feel that she's going to be so judged, that the stigma is so great that she actually might not even go get prenatal care. That's how strong it is. Even in the training among doctors and nurses and other healthcare people, one of the very important things that we do is to try to check ourselves. We try to ask ourselves, how do I feel about whatever whatever kind of disease or whatever kind of patient that I'm seeing, to be able to figure out how we sometimes act towards people. So it can be subtle. It can be that the person makes an appointment at a clinic and somebody's assuming that a certain type of person is going to walk in the door because he has an addiction. Or it could be that somebody might talk to a person maybe in a way that's not as respectful that they would normally talk to somebody else that's maybe showing up for diabetes. There are lots of ways that can be very subtle with how stigma is there. And it can also lead in families to suppress, right? So just like, we don't want anybody to know that little Jimmy's been using cocaine, so don't tell anybody. It's the same secrets of tragedies that happen in families, and they just get suppressed. And that never helps people, because when there's stigma and it suppresses any person's outward approach to get help, then what it causes is a worsened situation in the end, a worse outcome. In the case of the mom that doesn't get prenatal care, guess what? You run the risk of a baby being born and having more complications because there was not the care that that child and the mom needed during that time. This stigma is not well founded, and that people that suffer from addictions are just like anybody else. It's your pastor, it's your Little League coach, it could even be your doctor. That addiction doesn't care about your socioeconomics. It doesn't care about how much school you've had. It doesn't care what neighborhood you came from, and it doesn't care about your last name. That there is nobody that is immune to the effects of substance use. And that doesn't mean not only about the substance itself, but we also love people and have people in our lives that are important that might suffer from a substance use disorder, and so we might be affected peripherally. So it's important that we understand how to empathize and how to help people and how to make it easier to obtain health care, not more difficult. So I hope that you understand addiction a little better and the stigma around it, to extend yourself, to extend your hand, to extend your heart, and try to understand that somebody with an addiction is not a bad person, and that is somebody that deserves health care just like anybody else.